us for our first ever Mammo Go-Go and Jane Brattain Breast Center Coffee and Chat. We're so excited that you guys are here with us this morning, and we have the pleasure of having Jessica Lane, the Mammo Go-Go coordinator for Jane Brattain Breast Center, here with us to tell us some exciting updates about the Mammo Go-Go program and the center itself. But before I present Jessica, I just wanted to tell you a little bit about her. Jessica received her bachelor degree in public health promotion, focusing on women's health and refuge/immigrant health, as well as minors in child development and gerontology from Brigham Young University. She also attended the University of Minnesota, where she obtained her master's degree in public health with a dual emphasis in maternal child health and global health. Her passions have led her to focus on the intersection of culture and barriers to healthcare. She's also worked through volunteer work and professionally with immigrants and refugees for over 20 years. During the course of her education, she completed an assessment of barriers to prenatal care among resettled African refugees in Utah, an internship with the World Health Organization African Regional Office in Brazzaville, Congo, where she oversaw its adolescent health program, and for her graduate project, she conducted a research study entitled Female Genital Cutting, Clinical Knowledge, Attitudes, and Practices from a Provider Survey in the U.S., the largest and most informative national study ever done on the topic to date, which was used to advise the Office of Women's Health and the CDC. Jessica worked for a federally qualified health center in inner city St. Paul as their women's health coordinator, where she took their breast and cervical cancer screening programs from no events and almost no screenings in about 2 years to one event a month, and 500 plus women receiving mammograms in less than a year. She created and taught a women's health and biology class at St. Thomas University and has worked for the past 9 years running Pride Nicollet's mobile mammography community outreach program. Jessica and her husband reside in the southwestern suburbs and have 4 children, twin girls that just turned 8, a 4-year-old little boy, and an almost 1-year-old little boy. And so again, we're so excited to have Jessica here with us today. Jessica, I will hand it off to you.
Thank you so much. I'm so glad that we could get together and talk about it. It seems fitting for October and Breast Cancer Awareness Month, hence the pink. All right, I am so excited to talk to you guys about our Mammo Go-Go community outreach program. It's a huge passion of mine, which you're going to find out. All right, next slide, please. First, we're going to start off with talking about the Jane Brattain Breast Center. So it is located at the 3850 building, which is what this is the outside of. We have the primary site there, but we also have 7 other clinic sites with on-site mammography. Then we have one in Burnsville, Maple Grove, Chanhassen, Bloomington, the Women's Center, which is adjacent to Methodist Hospital, and Wayzata. With the rest of our clinics, most of them use mobile mammography. So that includes 11 other sites, which I get the pleasure of coordinating. So that includes Brookdale, Carlson, Champlin, Golden Valley, Plymouth, and Rogers, Egan, Eden Prairie, Lakeville, Minneapolis, and Prior Lakes. You can see we've kind of divided it between the 2 of the upper and Minneapolis area and the southern suburbs. In addition to servicing our own clinics and our own patients that way, we do between a 70 to 100 plus. I think our highest year was around 120, 125 outreach events, and that was in 2019, so just prior to COVID, kind of makes sense, per year. Last year, all of Jane Brattain, so this would include mobile mammography as well as the 7 sites with on-site mammography, we did 61,250 screening mammograms. Out of that, 643 cancers were found, and right now we're on track to actually find over 700 in 2023, which is both like a happy statistic because we're finding it and also kind of sad because it's a little bit higher than last year. Next slide, please. The cool thing that kind of sets Jane Brattain Breast Center apart from some of the similar breast centers is that we have 4 nurse navigators. So these are their pictures, so you can kind of put a name to a face. They are on site and they serve as the patient's primary contact. So they're the first person that would contact a patient after the diagnosis. They kind of are just there to be a sounding board, the emotional support, the health and clinical education education they need to understand what to do next. They would help coordinate the surgery consult, genetics, if there's additional imaging. They help with setting up appointments for medical oncology and radiation oncology. They also have access to the social and emotional support services, both like on site, but also like out in the community. They could help with financial assistance. There's just a lot of things they do. They are there to support the family as well as the individual. And they end up being that person that in all these appointments and all this information that's coming at you, they are that constant person to be there that helps navigate the patient through their Jane Brattain journey. Next slide, please. All right, so Mammo Go-Go, as I mentioned, we do focus on our Park Nicollet clinics that do not have on-site mammography, and we focus a lot on community events. So we partner with existing community organizations. Some of these might be fairly qualified health centers like Open Cities or Neighborhood Health Source. Sometimes they're larger organizations that serve a specific population, such as St. Mary's Health Clinics serve the Latina population specifically. We partner with them. We work with Lao Center, Indian Health Board, Native American Community Clinic. So it's kind of all encompassing. Some are community organizations that then offer screening. Some of them are clinics that don't have their own on-site and populations that have a difficult time getting to a different on-site place. So we bring it in for them. Community events were started in 2014. Which is when I was hired, and we can screen 29 to 31 patients. It depends a little bit on drive time and setup and that sort of thing per day. So that's quite a few. There's 3 ways that the women are covered. The goal of the community outreach program and Jane Brattain herself was to never have a woman turned away, regardless of, ability to pay, that sort of thing. So obviously we can take insurance even for community events on the mobile unit, just like what would happen in a clinic. Then we also partner with Minnesota's Departments of Health SAGE program, SAGE, just like it says on the slide. And basically what they do is they have state and federal funds that can be used for providing or covering the cost essentially of a mammogram and any diagnostics that are needed up to a point of diagnosis based on income and household size. So we partner with them for all of our community events. And lastly, we have some really, really amazing donors. And basically what happens is they decide they want to give to our fundraising that we do for Being Pink, and we can use those funds to provide interpreters on site, which will come up in a minute. We use those funds for anyone that maybe is just over the threshold of what SAGE says income-wise, but also doesn't have insurance and cannot afford to get the screening on their own. So our goal at the end of the day is just to make sure that no one is turned away. Next slide, please. So this is our population served by race in 2022. It's, I think, very interesting. You can kind of go through it yourself. I don't need to explain all of it, but you'll notice almost all of our patients, vast majority, about looks like it was 89% officially, were people of color. So the goal of community outreach is to bring on-site mammography through a mobile unit to populations that otherwise would find barriers, whether it be transportation, culture, language. A lot of these things these potential barriers can be tackled through bringing the machine on site, because then you're sitting there with interpreters that speak your language, but also with the population that you're used to being around, instead of going into a clinic trying to make your way through checking in process, especially if you're having to wait for an interpreter to arrive and then kind of doing it on your own. There's this sense of like sisterhood, essentially, that you're doing this together. We'll often find patients will come with a friend or a family member just because it's easier. And women, we're pretty social creatures. We like to do things together in groups, so it just makes sense. All right, next slide, please. Okay, Community events. So as of right now, I did data through September 30th. I didn't want to push it too much beyond that, but I did the data through September 30th, and we did 49 events this year. We are set to do 73 by the end of the year. As of the end of September, we have done 916 screening mammograms, and based on a conservative estimate, I like to be conservative personally rather than, overpromise, we're set to do about 1,350 mammograms by the end of the year just at community events. So this is outside of the clinics we do. This is just our community partners. And through events, we have found 8 cancers as of the end of September. Interpreters provided. I always find this fascinating. I wish we could kind of take the group to some of our events, because that is the most fun part, is being on site and being with different people and cultures and foods. And it's just the best, truly. So in 2022, so last year, we had 53.6% of our patients use interpreters and identify as non-English speaking. And this year we're actually at 55.6, which is interesting because of the remaining events for the rest of the year, 20 some. I think there's 20, 24? Hopefully my math is fast and correct. Anyway, with the remaining events, the vast majority of those we're actually providing interpreters at. So that statistic as far as the percentage is actually going to skew upward. So I thought that was interesting. Last year, we provided interpreters in 9 different languages. Right now, we're set to do 8. Obviously, that's just in anticipation of what populations we typically see with these partners. There could be more requests that come in, and we know about those through their pre-registration forms, so we would fill those. But right now, it should be about 8. Next slide, please. So I wanted to highlight 2 events just to kind of give you guys a feel of what they kind of look like, and the different populations that are served and that sort of thing, since we can't go on site. So I did try to make it a little bit more anonymous just by putting Spanish speaking event. But for example, this is an event that was done earlier this year. We screened 25 women and 7 of those needed follow-up. For anyone who might be more familiar with breast cancer screening, that's a pretty high percentage for needing follow-up. And we find that often in the community. There's a few different things that would, go into that. One of which is the fact that often they delay screening, both because of access, but also because of fear or cultural beliefs. We deal with some populations that, have a fear that, well, I didn't have this in my home country. Is the mammogram machine causing breast cancer? Which, of course, we know it's not, but it's a matter of trying to explain that. We have other populations that have a real hesitancy due to modesty, that they feel like they have essentially, sinned, for lack of a better way to explain it, just because they're choosing to expose a part of their body, even though it's for medical testing. So there's a lot of different cultural reasons why people might delay getting mammograms. So often, unlike a lot of women in clinics where they're coming in every year like they should, and we're catching things, a little bit more quickly, we're seeing often a higher need for follow-up due to the fact that sometimes it's been 2, 5, 10 years since their last mammogram. We have found that once we get that first mammogram done, the fear, I wouldn't say it's gone, but it begins to decrease a ton. I remember I have a patient that in my former job, I had to call, and she was due and she would not get screened, and she had a family history. She had all these red flags to me clinically where I'm like, I really need to get this patient in. How am I going to convince her? And I remember I scheduled her and then she canceled. I think it was 7 times before she actually showed up. And she finally showed up and she did it. And it was one of my last events I did in that position. And she was like, oh, now will you leave me alone, essentially, which she was teasing me. We had a good relationship, but I was like, yes. I was like, but thank you. I said, so what did you think? And she's like, well, it just wasn't as bad as I thought. Well, lo and behold, it's been 9 years since my new position, and she continues to come every single year now. It was just that immediate one, the unknown, the fear of, wait, what is this? Is it really as painful as people say? Do I really have to do this? That gets people to realize, okay, that was faster than I thought it was. While not comfortable, it's not horrible. All these little things that makes so many less barriers going forward. So hence the higher rate of follow-up. When I had pulled data, 3 of those have completed follow-up. This is not alarming in any way, because often they will also delay follow-up. So we're in contact with them. Our call center calls to make sure we schedule that follow-up. If an interpreter's needed, they call with the interpreter. There's a lot of access things. We also partner with our community partners to, especially if they're clinics, because their primary care provider via that clinic, and say, can you also have, your provider make sure they're giving kind of the same messaging. And we find that they often do come back for follow-up, but it's quite a bit later than what you would maybe typically see in a more Park Nicollet clinic type setting. Our community events just end up delaying their follow-up a little bit. Of the 3 who had completed follow-up, 2 of them needed biopsies, and then 1 ended up being a cancer case. Next slide, please. Okay, this one is just fun. So you will see that the diagram I made is language spoken. I don't know if anyone else loves cultures like I do, but check out all those different languages that were spoken at this event. Fantastic. So we did 33 women, 5 needed follow-up, 2 have completed the follow-up. Of those 2, 1 had a biopsy and 0 cancer findings. But the reason I wanted to throw this one in was just because this is kind of how a lot of our community events are. Sometimes there's only 1 or 2 other languages spoken, and sometimes it's several. And we work with our community partners to be as, I guess, efficient as we can be in saying, okay, we're going to do Hmong patients from 9 to 11. We're going to do Lao patients from 11 to 1. We kind of break it into blocks so that we can make sure we have enough interpreters on site, but not so many interpreters on the mobile unit that, it doesn't function anymore. But so fun to see so many different people coming together. I really love that part. Next slide, please. Okay, this is the growth of the program. I did not put on 2023, but we're expected to see an increase in both of the graphs. So the top one, we're looking at the number of women served. You can see 2019 was just a phenomenal year. We all know what happened in 2020, and we were shut down for half the year, so that impacts numbers. And then we've slowly been coming back up. We have had some staffing shortages kind of like everywhere in healthcare, but finally feeling like we're getting on top of that. So this year we are set to do, I wrote it down, hang on, 1350. So we should be right, up in the middle between 21 and 22. So that would be great. We did see a big increase for demand in 21, partially due to the fact that mammograms everywhere were shut down for about half the year. And the other thing is we saw a lot of hesitancy to return to anything patients deemed non-crucial, which to me a mammogram would still be crucial, but everyone's down to their opinion. And so a lot of them delayed coming and getting their mammogram in 2020 to 2021. So that's why you see a little bit of a spike there. And then as far as the number of events we are set to do, I think I said it earlier, I think it's 73. Next slide, please. So that is the program in a nutshell. Went a little bit faster than I thought, but I wanted to leave enough time for questions. Obviously, that's kind of the most fun part when you come to a presentation like that. So does anyone have any questions, comments? We'll wait and see if something comes in. Thanks for coming, though. Hopefully everyone got to drink their coffee. I have a water bottle next to me, but I didn't want to distract.
Like Annie has one. One moment. Let's see. All right. Annie, go right ahead.
Can you hear me?
Mm-hmm.
Yes.
Yeah, good. Jessica, good to see you again. Always a pleasure to interact with you. I'm curious on the follow-up, if an interpreter is needed. How is that handled? How is, let's just take something easy. A woman speaks only Spanish, limited English. She found a positive diagnosis. Is an interpreter assigned to her through the Nurse Navigator program? Or how do we meet the language and cultural needs as that patient moves through the treatment process?
Yeah, so we have a few ways. First of all, we would have it noted from their first visit that it's in their chart that they're a Spanish speaker. So even before we would have reached out to make the appointment, we would have made sure we had a Spanish interpreter on the line. So we have a department here called Interpreter Services, and they are phenomenal. I probably talk to them multiple times a week just because of my job. But they're amazing. So what we do in order to get interpreters, I'll back up a little bit. In order to get interpreters at community events is I know community events coming. I'm in conversations with that partner. We realize we need Spanish or Hmong or whatever it is. And I say, hey, I need a female Hmong interpreter at this event. Here's the location, here's the time. And they work with all the people we have contracts with to make sure that we have a provider on site. Then we get the results back. We see that, oh, this person needs follow-up. It's listed as Hmong, and we would get a phone interpreter on the phone before we would even reach out to that patient.
Good.
Then when we schedule that patient, we again note that they need a Hmong interpreter, and essentially we order interpreters. I realize that's a funny phrasing, but we order an interpreter to make sure that they're on site with the patient for any appointments.
That's very helpful. Thanks. I also need to share that as we share this story with institutional individual donors, the part that is most compelling for them or intrigues the most interest is one, not only do we have interpreted services, but secondly, if there's a positive diagnosis, that we continue to treat that patient and provide for the financial support for that services if that patient has no insurance. So St. Mary's Health Clinic, which I know well, I used to work for the Ministries Foundation and worked with Sue Gelson on that program. They work completely with undocumented individuals. And so they are not insurance eligible for probably most of the services. And so people are very impressed that it's a full continuum, not of a one shot and you're done. And I think that's a real unique feature to the Mammo Go-Go program.
That's great. Thanks.
Excuse me. Annie, you had something else?
No, I'm trying to lower my hand, but it's grayed out. It won't lower.
Oh gosh, okay.
I'll keep working on it. I'm gonna keep working on it.
Thank you. Well, it looks like Jody has a question. Let me get the mic set for you. Jody, what is your question?
Oh, she's still muted.
She's still muted. Okay.
Can you hear me?
Yes.
Yes.
Okay, so Jessica and I spoke a couple of weeks ago, and I'm trying to plan an event for the St. Louis Park community, specifically women in recovery and treatment centers. And so since Jessica and I talked, I think I've acquired the support of the city council, the police department, and the schools. And I'm wondering what my next step is. Jessica, do we put a date on the calendar and we work behind the scenes to solidify this, or what happens next?
Yeah, so when we have a partner who's interested, you and I will talk offline later,
Okay.
but when we have a partner who's interested, they reach out to me, and we kind of see what's the need, is there going to be, enough demand to do an event? Because we have some people who are like, oh, my neighbors and I want to host when there's 3 of us ladies. Probably not the best use, but we try to get them into another site. So we're trying to partner with the community organizations. And then once we have the support of the organization and we have made sure that it looks like it's a good fit for the program and as far as what we're trying to accomplish with it, then I work with them to get a date on the calendar, and then we kind of walk through how to advertise the event, what women are eligible, that sort of thing.
Okay, thank you.
Yeah.
We have one more question so far from Ivy. Let me get that for her. There we go. Ivy, what's your question?
Hi, thank you, Jessica. I've just been learning so much. So you mentioned that there's sometimes some hesitancy with the communities to do the mammogram. How do you do you do any kind of communication or education before the event for the populations to help them actually schedule their mammogram? What is that like?
Yes, so we do that through a bunch of our community partners. So we have information we have given them, as well as sometimes they'll do, I know I've done some like Q&A sessions like this where people have asked questions. They also sometimes will have community health workers that are from those populations and speak that language fluently, that will do questions and answers and kind of help women understand the need as well. Often by the time that we are going on site, they have been approached with education as far as safety, as far as what the exam would look like and entail, that sort of thing, several times prior. So there's a lot of education that goes on with us and our community partners quite a bit before we would actually even attempt to do a mammogram.
Awesome. Thank you.
Yeah.
We are loving the questions, everyone. Amy, what question do you have?
Hi. Okay. I would imagine that you have a lot of folks that are kind of repeat customers. So you probably have a lot of partnerships where you go every year. And so I'm just kind of wondering about your calendar. Is your calendar pretty full? Are you guys looking for more partners? Are you specifically looking for partners in certain areas, geographic areas, populations, or kind of how do you approach that work?
Yeah, so I think we'll like back up when the program was first being started. Obviously, there weren't partners on the calendar. And so what we ended up doing was actually my former job that I got recruited out of was the first partner on the calendar, which was Open Cities Health Center. And I knew what the demand was. So we got them scheduled. Then we worked with partially through word of mouth. Open Cities is the federally qualified health center. And I think there's, oh, don't quote me, I think it's about 11 that are here in the Twin Cities that all kind of have the same issue. Similar population, cannot go take the extra time to go get a mammogram, nor really want to go somewhere else because it's uncomfortable, but don't have on-site mammography. And so I reached out to them and kind of offer the services. And then we have gotten referrals from Minnesota Department of Health where people want to offer the SAGE program, but they don't have a SAGE provider in their area that will take SAGE. And so then they're saying, can you bring on-site mammography? So it kind of spread through word of mouth initially. Now we're at an interesting point, and it's a great problem to have. We are completely booked out for the rest of the year and have been for quite some time. Q4 is always crazy, partially because it's breast cancer awareness. So as soon as like October 1st hit, I think I came into the office and there was like 9 voicemails of like, hey, it's breast cancer awareness. Can you come this month? And of course, I unfortunately had bad news for all of them. But most of our community partners, we try to schedule in advance. So we have some partners we see monthly, we have some we see quarterly, we have some that have demand every other month, and we have some that are once a year. And all of our repeat partners, essentially, we schedule at the beginning, and then we still have open dates to try and take in new partners. Right now, we're just at the point where we're starting to put together 2024 calendars, and then I'll be reaching out to everyone we've done events for a long time to make sure we've got them on the books, and then we'll have some leftover dates that we can use for new partners. But at this point, we're not really actively recruiting partners because the wait list is longer than like my available dates. So I have a big long list anytime a date comes open of like, okay, these partners are wanting to try and do their first event. So it's a great problem to have. It's just, yeah, we're doing the best we can.
See, oh, Sandy, here we go. 1 second. All right, Sandy, what question do you have?
I think she's still muted.
Sandy, are you unmuted? I think she should be.
Oh yeah, now it is. Sandy, are you there?
Sandy, you're welcome to also type in your question too, whatever works best for you. Let's see here.
Hopefully she's able to type it, but we might be having a little bit of a issue there. We'll see.
Well, while Sandy is getting her microphone on, Candace does have a question. Since there's such a high demand, is the solution more Mammogogo trucks, or how can we solve the need issue?
Ooh, that would be fun. I don't know how much sanity I would have with another truck. We have 2 mobile units currently, which I don't know, a third could be kind of fun. But anyway, that would be a lot to take on too. I think more the issue is techs. So going to become a mammogram tech takes a couple of years because you have to become a radiology tech first, and then you specialize within mammography. So it's not a quick turnaround. And the interesting thing that we're facing, but kind of everyone's facing across the nation, is what happened to programs in 2020. They shut down. And so it delayed people getting out of their training. Then people were hesitant to go back to training for a little bit, and it takes about 2 years. So we have started to see an increase in the number of techs available this year, and I'm much more optimistic about next year. I think it was just a matter of getting them through their training, and that will help in and of itself. And then besides that, it's also just trying to be very efficient. So we have some partners that say, yes, I want a full day. I want, all 7 hours of screening. But really, the demand is only 15 women. So how about we do half a day, and then we can do another partner the other half? So I'm the one that kind of has to be, I don't know, I don't want to say the bad news person, but I'll say, hey, yes, we can definitely get done the women that are wanting to get done at your site. How about we do these hours? And then I can take that partial day and use it somewhere else. So it's also a matter of being much more efficient with our time rather than just saying, sure, everyone can have a full day when maybe they only need part of one.
Thank you. All right. Sandy, were you able to get your speaker figured out? And also, we can welcome questions offline as well after the meeting, just so everybody knows that. Let's see here. Ivy, what question do you have?
I'm wondering, are there other places in the metro or in this the country that are doing the mobile mammography unit model?
Yes, so there are some that do mobile mammography. The thing that kind of sets us apart is we do community events. Almost all mobile mammography machines are really only meant for their own clinics. So we have another healthcare organization here in the Twin Cities, which I don't know if I should name names or not, so I won't. But they have a mobile unit as well, but they only service their own clinics. They won't go out and do community events. So that's kind of the part that sets us apart that way. It's really interesting. People are looking for the community model, even outside the state. I'm more familiar with outside the state. The interesting thing is they try to look for, community mammograms, or they found out that oh, this clinic has them, but they won't come to my community event. And I end up getting calls from New York and Georgia and all over saying, hey, do you service this far? Which of course we don't. And so I'm like, oh, I'm so sorry. And they're like, yeah. And I said, well, it looks like you have a mobile program, and, I'll help them Google or whatever. And they're like, yeah, but they'll only service clinics. So the mobile mammogram is, it's not super common yet, I would say, but it is spreading, but almost everyone is sticking to their own clinic populations. And it is much more straightforward that way. Obviously, the community takes a little bit more work because you're having to work with partners and everything else. But that's kind of the part that's a little bit different about us, is the community work.
And
That's
again, I
awesome.
think that's a great selling feature, Jessica, that makes us really unique as a unit. And the fact that we go and how we partner with community organizations and go to their sites puts us right at the level of serving people where the need is the most. So I think that's just a terrific feature of the program.
Yeah, it helps a lot when you go to the neighborhood that the person is used to going to, right? If they're using public transport or whatever it is, it's right there. It makes it a lot easier. So
I guess that leads me to a follow-up question, if that's okay.
yeah, go for it.
So do you have people have organizations in the country, have they asked you to consult on helping them get a unit up or a program up? Do you do any of that?
I've been asked questions, but I haven't been asked to consult yet. That would be nice,
Just curious.
though.
Just
Wonder if I
curious.
could do
That'd
that
be
in
really
my off
cool.
hours.
Yeah, with all the time you have.
All the
Yeah.
extra time I have. There isn't much, but hey, we could find a use for it probably. But yeah, we get asked a lot of questions. I come from a really strong research background, which was kind of explained in my bio. And I often wish like we were, which there's a lot of reasons why we're not, one of which is time, but I often wish we were publishing more of what we're doing on the community level, just because it is such a new space. There's so many people that do clinics, and there's a need in those states for community, because I'm getting those calls, but we haven't done, I don't know, we've been focusing on serving the patients, which is the most important part, but maybe it is something that we start looking at, okay, here's a way to get other states to kind of have something similar. Because I mean, based on what I see, the need is national. It's amazing how many calls I get from out of state. And I'm like, how did you even find us? And it's just through Google, apparently. But I am always surprised when I get these calls with these area codes. And now I get enough that I call back and I'm like, hey, I noticed your area code. Like, do you still live where this area code is? And if they say yes, I'm like, I've got bad news. But we do talk through it a little bit. But yeah, I don't know, you might be onto something there.
Just curious, but the work you're doing is amazing. So,
It's
serving the patients
really
is first.
cool.
Mhm.
Yeah. And it hasn't been done a whole lot. People stick to their own clinic population, which helps those patients for sure. But I think having the combination of the two, while extremely challenging for our team, just with, barriers that we also face with different cultures and things like that, right? They take more work than just saying, hey, we're going to go to the Prior Lake Clinic. Great. We set up for that. It's pretty straightforward. It takes more work on our end, but it's so rewarding in the end to see these patients that are, sometimes in late 50s or even early 60s and say, this is my first mammogram. And I'm like, wow, okay. But like I said, once they get that first one, we typically see them back, which is great. So just have to get over that initial fear.
Thank you so much, Jessica. And thank you for all of these questions. We have a couple minutes left. Does anybody else have anything they want to ask Jessica? And I can check our Q&A here too. Well, you guys, thank you so much for coming today. And Jessica, thank you for your time and for sharing your expertise. You guys are doing such wonderful work through the Mammo Go-Go program and at Jane Brattain Breast Center. So it's a pleasure to be with you today virtually and everybody. So thank you everybody for tuning in. And as I mentioned, we can take questions offline, and I will also be sending an email after this. So if you think of questions after the meeting, I'd be happy to forward them to Jessica. So thank you very much, everyone.
Please do. Thank you for letting me explain my passion, because this program really is my passion. So thanks for letting me share that today. That was really special. So, and in the follow-up email, are you going to send out the video too?
Yes. Mm-hmm.
Okay, so there's a video, so you'll all know to look for it, that I made last year. Yes, I was hugely pregnant, right? I said I had an almost 1-year-old. Anyway, but we did a video that was able to spotlight it got shots from some of our events. So you'll actually get to see what the event looked like in like real time, as if you were there, which is really phenomenal. So I hope you guys get a chance to look at that. Thank you again.
Thank you.
Bye.